Hi, Dr. Thaper here with the Superhero Lifestyle. Today I thought I would spend some time talking about congestive heart failure. Very common condition. It is the number one condition that causes patients to be readmitted. Actually, it's not the number one. It's one of the leading causes of readmission to the hospital after being initially hospitalized. So it is simply layman's terms, not using too much medical terminology so everybody out there can understand. Heart has four chambers, and the left lower chamber, when the heart beats, it pumps the blood that is in that chamber forward into the circulation. Okay, a normal healthy heart can beat up to 55 to 60% of the volume that is in the left chamber into the circulation. Okay, over the years, due to age, due to heart attack or other causes that are out there, this pumping mechanism can slow down. So if you imagine, if the pumping mechanism slows down, then instead of 55%, the heart may only be able to pump 40, maybe 35%, and the rest of the volume tends to back up and cause congestion. The fluid can go to the lungs, causing shortness of breath. Eventually, the right side of the heart can get affected. The liver starts to get enlarged. The lower extremities start to get swollen. And you may have seen that in patients. And people who have congestive heart failure know what I'm talking about. So that's why it's called congestive heart failure, because there's congestion going on in the heart. What are the causes? The common causes out there are coronary artery disease. Somebody who's had heart attack, a massive heart attack, or multiple heart attacks, a part of the heart muscle can die, so it cannot participate in that pumping action, that contraction of the heart, which leads to the volume being flushed forward. Okay, long-standing uncontrolled hypertension can cause it. There are hereditary causes that can cause it. There are other metabolic conditions out there that can cause it as well. Alcohol can cause it as well as one of the causes. Now, what are the common signs and symptoms of congestive heart failure? Shortness of breath is one. You would notice that doing minimal exertion causes you to be short of breath. Okay. It'll be difficult for a person to lay down flat, especially at night. They will wake up in the middle of the night gasping for air, and they cough up like a pink frothy sputum. That's one of the common signs. Of course, swelling, leg swelling, chest pain, wheezing, all those are signs and symptoms of congestive heart failure. And these signs and symptoms should prompt one to go see their primary care physician or eventually a cardiologist. Okay. If these symptoms are not managed appropriately, either with medications or if it's a newly developed congestive heart failure, it can go into a condition called decompensated or acute congestive heart failure, where the fluid overload is so much that the patient is having difficulty breathing and they need oxygen, sometimes even need to be on the ventilator. Okay. So how is that treated? Patient gets admitted to the hospital. Patient is giving IV medication, IV diuretics. Lasix or furosemide is a common medication, also known very commonly as the water pill. Okay, that is given in an IV form at a very high dose in attempt to get the extra fluid out of the body so the person can breathe better, can be free of the cardiac symptoms, and then they can go on living their daily routine life. Okay, so medications that one needs to be on when somebody has congestive heart failure. One is a diuretic, is a must. Okay, diuretic is also known as a water pill. Furosemide or Lasix. Lasix is the brand name, and furosemide is the generic name. Is patients are commonly on who have congestive heart failure. Other medications are lisinopril or angiotensin converting enzyme inhibitor. Sorry to use medical terminology, but that's what it is. That's also one of the commonly used medications. And then, medications to reduce blood pressure, medications to control the heart rate, and other medications which are used if somebody has a condition that led to the heart failure. So if somebody has a history of heart attack, they need to be on an aspirin, they need to be on cholesterol-lowering medications. So these are the common medications that a congestive heart failure patient is on. Now, in the beginning of the video, I talked about that is one of the leading causes of readmission to the hospital. Because congestive heart failure, if not managed properly, can decompensate or flare up rapidly. And then symptoms can come back, leading somebody to go back to either hospital or even, worse, ICU. It can be fatal. So there are very simple steps one can take to make sure that their medication is working and they make sure that their congestive heart failure is being treated appropriately. Number one is weight. Make sure that you monitor your weight. There's a lot of home health agencies out there that check patients' weights after being discharged from the hospital on telemonitoring. They have patients step on a scale, register the weight, and that weight goes to patient's cardiologist or primary care physician who discharged the patient, and they can compare the discharge weight versus this new weight, and then can either make changes to the medication, the diuretics, or just use it as a tool to monitor progress. Okay, so if somebody who has this condition and they're beginning to gain weight and they don't know why, they should see their doctor immediately. Okay, so check your weight routinely, take your medications routinely. Do not skip diuretics, ACE inhibitors, or other medication that I mentioned earlier. These are very important. These medications keep your volume status, your body's volume, in check, because it's helping the heart get that extra fluid into the circulation so it doesn't clog up or get congested and go back into the circulation. Okay, monitor your salt intake. Okay, monitor fluid intake. Do not drink excessive fluid, just enough to keep yourself hydrated. As you know, if you drink too much, that can also overwhelm the heart. So that's my general synopsis, very brief synopsis of what congestive heart failure is and what one should look out for. Hopefully this information was helpful. More information like this, keep tuning in to Superhero Lifestyle, and don't forget to subscribe. Thank you.